Hi guys. So I actually had a hard time finding an informatics nurse to interview because I don't work directly within a hospital. I work with One Legacy right now, and I'm in multiple different hospitals at any given time. I was hoping to maybe kind of find an informatics nurse while I was in location, but that just didn't happen, seeing as I work night shift. So I actually went onto LinkedIn and searched for informatics nurse positions in our area, and I actually located an informatics nurse within another hospital and was able to interview her. She was kind enough to respond to my email and set up an interview with me. So my nurse that I interviewed, her name was Jennifer. She is currently an informatics nurse over at San Gorgonio Hospital. She came from Arrowhead, where she had originally learned and trained everybody on the Epic system once Arrowhead switched over from Meditech to Epic. And she was over at Sanji. So some of the questions I asked her when describing her career path to her current position, she explained how she obtained her associate's degree in chemistry first, followed by her BSN, and eventually received her master's in healthcare administration. Like I mentioned before, she used to work at Arrowhead, and Arrowhead switched over from Meditech into Epic, and she was actually brought in to the informatics department once they made the change there. She spent a lot of time training everybody and eventually worked her way into management, managing Epic and the training modules over there. Before she left and went over to San Gorgonio Hospital in Banning. So I'm asking the question, discuss the value of informatics as a driving force in delivery of healthcare at her facility. She stated that they recently have gone live with their process. They use Allscripts over at San Gorgonio, and she says that she's still trying to get the hospital to a point of managing the electronic health record with the trustworthy data to deliver higher quality of care in their facility. When asked what safeguards and decision-making support tools are being used with Allscripts, she stated that the safeguards in place at Sanji kind of help really the clinical decision support. She did say that they're not very robust as far as the safeguards there, but they do have some safety alerts within the hospital when it comes to like medication administration or any contraindications. It'll flag for the nurse to see. But she did say that she wasn't a huge fan of Allscripts, and that Epic definitely had some more robust safety measures in place. When asking her about the patient care technologies that have improved patient care at her facility, she did say that it's a new workflow that they have there that will allow the radiologist to document like their contrast administration in a way that the nursing administration can view it, also allowing the radiologist to see any safeguards that might be in place there, as far as like maybe some allergies that patients may have. I guess apparently the systems that they had before didn't allow them to kind of read within the different departments, and now they can. As far as what group of healthcare workers rely on her to collect high quality information or data, she did say that healthcare workers across the board, doctors, nurses, even ancillary services, are all impacted on the quality information that she's able to collect within the hospital systems. For those of us who do know where San Gorgonio Hospital is, it is a very small hospital, and at this time is not currently on a magnet journey. They have a lot of work to do if they wanted to get to that point. her working relationship with the IT department. So actually, she has to work within the IT department very closely. In fact, the day that we did our interview, she was actually on call for them. So any people who got locked out of the systems, she had to reset it for them. She was responsible for printer issues within the hospital, providing provisional access to users and assisting with password resets. And she actually did get a couple of calls while we were doing our interview. So there were actually, I know we were only supposed to come up with one question, but as we were talking, I kind of asked her a couple of different questions. One of the questions that came to mind was, do you notice increased workplace satisfaction among employees when the employees have a better understanding of the information technology that is being utilized? And she actually did say that employee satisfaction was on the rise within San Gorgonio Hospital. And that I guess management used to count data by the hundreds prior to her starting there. And once she started, she created an export report that allowed the management team to save time, and they don't have to hand count the data anymore. Now they have this export report that they use. So I guess she's earned a lot of kudos with the management team in that way. Another question that I asked her was, what makes a hospital choose one particular electronic health record program over another? It does seem I have the luxury, fortunately, of being in all these different hospitals in our area, and so I actually am able to see multiple different electronic health record systems, Allscripts, Meditech, different versions of Meditech, Epic, Cerner, PowerChart. There's some that I don't even know what the names of them are, and they're very difficult to navigate, and I don't get training on these programs. Like, I go into these hospitals, I am given a username and a password, and I have to try to figure out how to navigate these hospitals. Hemet Hospital is the worst. That I had such a hard time navigating that system. Riverside Community, which is where I was at tonight on a case, actually uses Meditech. However, they also have another program that's called Patient Keeper that they use on top of Meditech. So you kind of have to know where to go and how to find these systems. But she did say that hospitals choose certain electronic health record programs over others, which is more based on money and politics. Obviously, Epic is probably a more expensive program, she said. So, the bigger hospitals use the better programs, and sometimes the smaller hospitals end up using the cheaper ones. But I was really interested in why some hospitals choose certain programs over others, especially when some seem to have more ease of use, if that makes sense. When I did ask her what challenges she faced in dealing with other disciplines that may not understand the role of the nursing informatics, she did say that sometimes people think when you leave bedside to pursue informatics that you get this stigma of being like a lazy nurse, like you no longer want to work bedside, you want to go do something easier, and that's really not the case. She did say that once people get exposure to informatics nursing, that they generally turn their mind around and have a little bit more respect for what she does, but that sometimes informatics can be just as challenging as bedside in other ways. So I thought that was interesting. Actually made me kind of feel a little bit bummed for her that that's kind of what people think about the role as an informatics nurse, right off the top, without actually understanding what the role contains. And then, the final question is, how will completing this interview impact me personally as a master's prepared nurse? And I think that it just gives one more realm of interdisciplinary team to work with, right? Like, we're used to working with pharmacists, physical therapy, respiratory therapy, nursing, MDs. We don't ever really think of the informatics nurse as part of the IDT team, and now I do. And I think that will make me a more well-rounded nurse practitioner in the end, because it's just one more tool in my belt, someone else that I can lean on in the event that I need something. So I kind of really enjoyed doing this interview. It really helped to kind of understand exactly what the nursing informatics role is. And I was happy to get to know her.